Hello guys. This is Dr. Rizwan Mirza. Welcome to my channel at Cardiologist. Let's discuss hypertension today. It's a vast topic, so in this video we will cover the basics regarding raised blood pressures. So, what exactly does high blood pressure mean? High blood pressure, also known as hypertension, is a medical condition defined by consistently elevated blood pressure in the blood vessels. What's systolic and diastolic blood pressure? Blood pressure is expressed using two numbers, that is systolic pressure over diastolic pressure. The systolic pressure represents the force exerted on the vessel walls when the heart contracts, while the diastolic pressure represents the force when the heart is at rest between beat. At what reading do you label a person to have hypertension? Person with multiple blood pressure readings of 130 over 80 or higher on multiple occasions is defined to have hypertension. Classification. According to Joint National Committee, systolic blood pressures of less than 120 and diastolic less than 80 are considered normal blood pressures. Systolic pressures between 120 to 139 and diastolic between 80 to 89 are called prehypertension. Systolic pressures between 140 to 159 and diastolic between 90 to 99 are called stage 1. Systolic pressures of 160 or above and diastolic of 100 or above are called stage 2. While according to American College of Cardiology and American Heart Association, normal blood pressures mean systolic less than 120 and diastolic less than 80. While elevated blood pressures mean systolic pressures between 120 to 129 and diastolic pressures less than 80. Stage 1 means systolic pressures between 130 to 139 while diastolic between 80 to 89. And stage 2 means systolic pressures of 140 or above and diastolic pressures of 90 or above. Any pressure above 180 systolic and 120 or above diastolic is considered hypertensive crisis, for which immediate consult from a physician should be taken. A person with following risk factors is at risk of having hypertension. Risk factors are divided in two broad categories: non-modifiable risk factors and modifiable risk factors. Non-modifiable risk factors include older age group, male gender, family history of hypertension, African inheritance. Genetic problems are one of the risk factors of having a hypertension. Besides that, pre-existing medical conditions like diabetes or chronic kidney disease or Cushing's disease or primary aldosteronism are risk factors of having hypertension. Among modifiable risk factors: unhealthy diet, obesity or overweight, lack of physical activity, increased salt intake, alcohol intake, smoking and stress can cause hypertension. Let's see how many types of hypertension are there. There are two main types of hypertension: primary hypertension and secondary hypertension. Primary hypertension, also known as essential hypertension, is the most common type, accounting for about 90 to 95% of cases. The exact cause of primary hypertension is often unknown, but it is believed to result from a combination of genetic and environmental factors. Then comes secondary hypertension, which is caused secondary to an underlying medical condition like kidney disease, hormonal disorders, for example adrenal gland disorders, certain medications, obstructive sleep apnea, and drug abuse can cause hypertension. Let's discuss the investigations that are usually done in a hypertensive patient. There are different investigations which broadly depend on the suspected cause of hypertension, which may include home blood pressure readings, ambulatory blood pressure, ECG, echocardiogram, fasting lipid profile, fasting blood glucose, urea, creatinine and electrolytes, urine DR, and there are specific tests for secondary causes. Let's move forward to the treatment options for a hypertensive patient. Patient in pre-hypertensive group is per JNC classification, or stage 1 group is per ACC and AHA classification, need to be managed mostly with lifestyle modifications, which include adopting a healthy diet, such as the DASH diet, which emphasizes fruits, vegetables, whole grains, lean proteins, and low-fat dairy products. Reducing sodium intake. Maintaining a healthy weight. Engaging in regular physical activity. Limiting alcohol consumption, and managing stress. For Stage 1 patients as per JNC and Stage 2 as per ACC and AHA classification need medications to control their pressures. The choice of medication depends on various factors, including the individual's age, overall health, and other medical conditions they may have. Medications include ACE inhibitors, angiotensin II receptor blockers, calcium channel blockers, diuretics, beta blockers, and others. If you suspect you have hypertension, consult with a healthcare professional for an accurate diagnosis and appropriate management plan. Over time, uncontrolled high blood pressure can lead to serious health complications, including an increased risk of heart disease, stroke, and kidney disease. Don't forget to subscribe to my channel at Cardiologist and please like and share the video.